Alright, these are the bones of the axial skeleton, and I'm going to start with the cranial and the facial bones. This one is the frontal bone. These two right here are the parietal bones. Back here is the occipital bone, which has the external occipital protuberance, and this is the connection point for the muscles that allow you to hold your head up straight and to tilt your head back. The temporal bone is right here, and right here is the temporomandibular joint, the mastoid process, the styloid process, the external acoustic meatus, and right here is the squamous part. Okay, so the internal view of the temporal bone shows the petrous part, which houses the middle and internal ear cavities. And then right here is the internal acoustic meatus, which allows for cranial nerves 7 and 8 to pass through. So the sphenoid bone, which is in here, has the superior orbital fissure, which would be up in here. There's no holes, but it would be up in there. And it allows for nerves that allow for eye movement to pass through. And then the internal view shows the lesser wings and the greater wings. Then again, back to the optic canal, which are those holes right there. And they allow optic nerves to pass through. And then right inside here is the sella turcica, which is where the pituitary gland is. So next is the ethmoid bone, which is up in here, but we're going to be looking in here for the crista galli, which is the connection point for the outermost layer of the brain to attach to secure itself inside the cranial cavity. And then right here would be the cribriform plates, which have little holes called cribriform foramina, and they allow for olfactory nerves to pass through from the nasal cavity up into the brain. So now we're going to put this back on. And the sutures of the brain, or the cranium, include the coronal suture, which is formed by the frontal bone and the two parietal bones, the sagittal suture, which is formed by the two parietal bones, the lambdoid suture, which is formed by the two parietal bones and the occipital bone, and the squamous suture, which is right here, will be formed by the temporal bone and the parietal bone. So now for the facial bones, this would be the maxilla, and then the alveolar processes are here, which is where the teeth fit into, the nasal bone. The zygomatic bone forms the zygomatic arch with the temporal bone. The ethmoid, which is inside here. The vomer fell out, but it's here. It would be right in there. And it forms the inferior part of the nasal septum. The superior part is formed by the perpendicular plate. Those two together form the nasal septum. The two inferior nasal conchae are inside here, and they form the lateral walls of the nasal cavity. The mandible is made up of the body, the angle, the ramus, the mandibular condyle, the mandibular notch, and the coronoid process. Okay, so now I'm going to point out the structures on the vertebral column. First of all, the vertebral column is composed of 4 curves: the cervical, the thoracic, the lumbar, and the sacral curves. The cervical and lumbar are considered to be secondary curves, while the thoracic and the sacral are considered to be primary. The first 7 vertebrae are cervical vertebrae. The first one is the atlas vertebra, and it articulates with the occipital condyles, which help hold the skull up, and it also forms the joint which allows you to make the yes movement. And then also what's unique about the transverse processes of all cervical vertebrae is that they have these transverse foramen inside of them, these little holes right inside there, and that allows vertebral arteries to pass through these little foramina. So then the next 12 vertebrae are the thoracic vertebrae, and it includes, take this apart, the spinous processes and the transverse processes are right here. The intervertebral foramen are right here, and that is where the spinal cord goes through. The body, or the centrum, is right here, and they're separated by intravertebral discs. So put this back on. The last 5 vertebrae are the lumbar vertebrae, and they're followed by the sacrum, which is formed by 5 fused vertebrae, and then the last tip here is the coccyx. So now the sternum. The sternum is composed of the manubrium, the body, the xiphoid process, and the jugular notch. And then the 12 pairs of ribs are obviously right here. The first 7 pairs are considered true ribs, or vertebrosternal ribs, because they all attach to the sternum. And then the last 5, 1, 2, 3, 4, 5, are vertebrochondral ribs, because they don't attach to the sternum. And then the last 2 ribs are floating ribs, because they don't have any anterior connection at all. Lastly, about the ribs, there's the head, which is right here, and it attaches to the vertebral column, the neck, and then the tubercle of the rib. The head attaches to the vertebral column at 2 points. One is the same numbered thoracic vertebra, and then it also attaches to the one just superior to it.